We're going to start our tech updates with medical metrics using AI for imaging assessment to augment clinical decision-making by Dr. Pierce Nunley.
So, well, as augmented and AI has really gotten a big part of this program, I think that one of the interesting things is being a part of that in different aspects, certainly in data, but also now in imaging. So we start off with a problem statement, right? Enabling controlled motion is a primary function of the spine. Okay, we get that. And we have treatments to design and eliminate motion and preserve motion. But we really don't have good tools for that and for measuring that. And so medical metrics began many, many years ago with the QMA technology to validate and produce accurate and reliable X-ray measurements. And this has been used extensively in over 200 scientific publications. And the majority of the papers for FDA studies, et cetera, MMI has used this technology to validate those publications. Now, what we do is we take lateral x-rays of the cervical and lumbar spine, both dynamic and motion, and this is put into the packs for an integrated workflow. It is FDA cleared, and it's a supplement to physician's diagnosis. Well, what do we do with the AI? Well, the AI, basically, you first have to take that image, and it's just a picture, right? The computer then has to do image view classifications. We then do vertebral body segmentation and labeling. You then need to find all those vertebral body corners. This sounds simple, but it's really not necessarily that simple. And then you have to do registration, find the femoral heads, and then start to look at more complex measurements like segmental, regional, and global calculations, and then analyze all that into the output. And that takes an unbelievable amount of code, and then once it's fed into the AI actually learns. So what can we use this for? Well, the first one is fusion assessment. You know, is there residual motion? And this is one of my patients that 5 years post-op, she did well initially, but she started having worsening neck pain and arm pain. And she had failed physical therapy. On the left, you see the typical report that is put out currently for each level, and it will highlight any parameters that are out. Now, at C6-7, it's showing the rotation of 1.9 degrees. Now, mind you, in most studies, that would not be considered to be a pseudo. That would actually be considered fused. And so be careful, this is point number one, when you read studies about fusion and pseudoarthrosis, they're setting a point that there are going to be patients that aren't really correctly labeled in that study. So be careful with that. Because here, when you look at stabilized image and you can see C7 is stabilized, there is no question 6-7 is moving. No question. And so I say it's kind of like pornography. I can't really define it, but I know when I see it. So here you can see that this patient is not fused at 6-7. Now, we've also got some new parameters that AI can do, and that's called strain. And when we look at anterior-posterior strain off to the right, we can see this is 5 and 8%. And when you see that, we're now finding that that is highly sensitive to look at whether or not somebody's fused. And these are some of the cool things about AI that we're able to now bring to the forefront and be able to write some papers and find some other metrics by which we can maybe have better tools to measure this in the future. Well, what about lumbar instability? So is a spine mobile or not? That can be kind of difficult. So here on the report, it shows you that at both 4-5 and 5-1, 4-5s have its previous decompression and coflex, but both have a spondylolisthesis. That's great. But all of these parameters below that are hard to calculate, and one is your lordosis distribution index, your LDI, which is becoming more important. So when you have a hypolordotic segment, that's saying, well, you've got a bad distribution of lordosis. Again, these are automatically calculated, and you don't have to feed them in to some program to be able to figure that out. Well, when you look at the flexion extension views, you don't necessarily appreciate how much that's moving, but again, once you do the stabilized movement imaging at L5-S1 and S1 is stabilized, it again becomes really obvious to your eye and also to the patient's eye, because you can show them this, that this is actually an unstable segment. So in the future, what are we planning on? We're looking at all of these parameters, and again, to be able to calculate these takes a long time, but if the AI does it, and literally it does it in 45 seconds in the background, I say calculate it, it comes back into the PACS, and I can see all these images. So AI for spine and x-rays, it's fast, it's an easy tool, it looks at overall alignment, instability, any abnormal movements, and also pseudoarthrosis. Patients really love this. When you show them this, all of a sudden they get it, and so that's really cool too. I think it's going to help us prevent misdiagnosis. Say, oh, I'm not really sure that's fused. You see that 6-7, you know that's not fused. You don't need to have any further discussion. And I think it will also help us guide treatment protocols in the future. And it's an independent and verified documentation for these things. So, for example, insurance companies want to see that, and this is an arm's length away. You don't need a radiologist. So I think it's going to help us get surgeries approved with this better documentation in the future. Thank you.